Hi, it's Dr. Elisha Van Dusen at New Hope Chiropractic. Today, I'd like to share with you some of the dangers of amalgam fillings. All amalgam fillings contain approximately 50% mercury, and research has consistently shown that these fillings expose dental professionals, dental staff, dental patients, even unborn fetuses to mercury vapor and mercury-containing particulates, additional forms of contamination that contain mercury. Mercury is a highly toxic heavy metal element, and there's no known safe level of exposure. Dentists have been using these dental amalgam fillings for over 100 years as a filling material for tooth decay. But does a century plus history of use make this filling a safe choice when it comes to your health? Well, the answer really is no, because of toxicity. The American Dental Association states that dental amalgam is considered a safe, affordable, and durable material that's been used to restore tooth health for more than 100 million Americans. However, it's a known fact that every time a person with an amalgam filling chews, the mercury that's inside that filling is actually released into that person's body. It can even form a vapor. Mercury poison is a serious health concern around the world and has a cumulative effect, and amalgam fillings are one of the top contributing causes. And the FDA admitted the true risk of amalgam fillings, and then literally millions of people would have to figure out whether or not they would have the fillings removed, and if yes, how to pay for the removal. That's if the FDA admits the true risk of amalgam fillings. In 2009, its ruling reclassified mercury and amalgam as both having greater risk, class 2, but not outlawing them altogether. So it's not surprising, because it would pose a major inconvenience for so many. But let me now tell you why removing the amalgam fillings in your teeth might be very much worth it, and why you should opt for an alternative to amalgam fillings in the future when you have cavities in your teeth filled. Your overall health really is worth it. So let's talk a little bit about the recent history of amalgam fillings. In 2009, the FDA reviewed scientific evidence presented in regard to the serious health hazards of the mercury-based fillings sitting in the mouths of millions of Americans, and what they learned then made it make a serious change about this. July 28, 2009, the FDA issued a final rule, and it reclassified mercury from a class 1, which is the least amount of risk device, to class 2, greater risk device, and also classified dental amalgam as a class 2 device. And it also designated a special controls guidance document for dental amalgam. In this document, it even admits that dental amalgam also releases low levels of mercury vapor, and it's a chemical that at high exposure levels is well documented to cause brain damage, neurological damage, also damage to your kidneys, renal damage. Mercury vapor concentrations are highest immediately after the placement and removal of the dental amalgam, as the material is agitated the most then, but it declines after that. So anyway, the FDA admits that the negative health side effects are specific and also well documented, but it still wants to continue to use mercury fillings even though there are better alternatives. It's hard to believe, but that's what's going on. So it's admitting amalgam fillings are more dangerous than originally believed, but it's still not enough protection for the American public. So they really need to know what amalgam is all about. Most people have amalgam fillings. Chances are, if you've ever had a cavity filled, it's filled with amalgam of some sort, which has been the number one filling choice of dentists across the country for tooth decay. And it's composed of liquid mercury, about half, and also powdered alloy metals like silver, tin, and copper. And it gives it a silver color, and that gives it the nickname silver fillings. They've been used for over a century. And even though it's a long time, according to a plethora of scientific data, these amalgam fillings still leach dangerous toxic mercury into the bodies of everybody who has them. And both acute and chronic mercury exposure can cause adverse health effects during any period of development. In an ideal world, children as well as adults would never have any mercury in their bodies at all, because this heavy metal provides absolutely zero physiological benefit. Quite the opposite. The effects of mercury fillings are also cumulative, so the longer you have the fillings in your mouth, the more mercury actually leaches into your system over time. So the dangers are many. The Mayo Clinic states that a small amount of mercury, about 2 to 20 micrograms a day, is released from an amalgam filling whenever it's mechanically manipulated, like by chewing. Chewing gum actually is one of the worst things you can do if you have amalgam in your mouth, because it releases an amount of mercury greatly above average and the normal amount with regular chewing, because you're constantly chewing on the same thing on the gum. It also says that the normal flora present in our mouths changes some of the mercury into other forms like methylmercury, which have been shown to be incorporated into the body's tissues more easily. So the chemical composition actually changes depending on what you're eating. And then the mercury vapors released increase with any type of mechanical manipulation or stimulation. Things like chewing your food, chewing on some gum, grinding your teeth too will cause mercury particulates to be released. But also, this kind of stimulation can come in the form of heat and dental procedures, like cleaning your teeth, for example. And this simple stimulation that occurs every day in a person's mouth, this dangerous toxic mercury vapor is released and increases. Most people drink some form of hot drink every day, hot tea or coffee, and even though it's a simple, everyday, enjoyable drink activity, these temperatures in your mouth increase with that, and it increases more mercury vapor. Even chew a piece of meat that's a bit too tough, or a popsicle or a stick of gum or something like that, or hard candy, while this agitation again increases the mercury vapors released into your mouth, and that gets into your exposed and absorbed by your body. And this has been linked to kidney damage, brain damage, urological damage, fertility issues, neurological problems, and also renal problems. And they're more severe in children because they're still developing, even in fetuses. So here are some signs and symptoms of mercury exposure from amalgam fillings. At least 100 mercury poisoning symptoms directly or indirectly result from chronic mercury poisoning. And the number and severity of mercury poisoning symptoms depend on several factors, like how many fillings you have, how long you've had them, how they're stimulated, and how often they're stimulated. So some of the many possible symptoms of mercury poisoning from these fillings are emotional instability, loss of appetite, general weakness, fatigue, skin changes, cardiovascular problems, endocrine disruptions, headaches, insomnia, immune system impairment, hearing loss, psychological issues, mood swings, depression, nervousness, anxiety, respiratory problems, tremors, and weight loss. So as you can see, the list of symptoms from these fillings and poisoning of mercury is long and varied. And with all types and symptoms, signs of health issues, they can vary from one person to another, as each person's body chemistry is a little bit different and results in a variety of different symptoms. So that's why you should maybe consider getting those amalgam fillings removed. So if you do have them, you'll need to contact a holistic health care practitioner for advice on safe removal, or a holistic dentist, nutritional support, and also appropriate detoxification from mercury exposure. And during the days immediately after the removal, your body mercury levels will actually go up a little bit before they decrease. And after the removal, though, the level should go down significantly in the weeks and months afterwards. It's vital to arm yourself with information and take action to protect yourself and your family from the dangers of mercury exposure in your mouth. And the removal of fillings has been shown to improve many serious and chronic health problems like periodontal disease, gum disease, immune system disorders, allergies, asthma, chronic headaches, ADD, ADHD, blood conditions, Crohn's disease, GI problems, dizziness, vertigo, arthritis, even Lou Gehrig's disease, Alzheimer's disease, Parkinson's, chronic fatigue, memory disorders, fibromyalgia, infertility, depression, insomnia, anxiety, susceptibility to infections, antibiotic-resistant infection, sinus problems, hearing loss, vision problems too, eczema, skin conditions, thyroid problems, candida, PMS, and even diabetes can be affected. So there's several alternatives to amalgam fillings. after you get the fillings removed, the silver fillings removed. Composite fillings are very popular: glass, plastic, ionomers, and also gold foil. And in the near future, stem cell fillings might even be an option. But you should really be concerned about this toxicity and visit a holistic health practitioner or holistic dentist, and they'll be able to safely remove the amalgam fillings for you and replace them with some more safe alternatives. So I hope this helps, and as always, check out our website, newhopechiropractic.com. And with that, I hope you have a healthy day.